I finished my fellowship in July of 2009. Cardiology is just, it's always fascinating. My father was a physician. He used to drag me when I was a kid after church and Sundays to rounds and go to the hospital. And so I knew medicine was the right fit for me. And at some point in time in your training, you start doing things and something just captures your attention. And I think cardiology was it for me. Cost associated building a center when you're talking about a fixed unit, it's a lot. You got to have a larger piece of equipment. You got to have a larger room. You got to have power handling requirements. You got to have backup power in an ASC center that can support that kind of equipment. It's a big undertaking. You got time associated with installing it. A C-arm is so much more of an affordable solution than a fixed unit. And so it allows you to really take that gamble, to take that risk. When you have a portable solution, you can do, I'd say 90% of what you can plan on doing with the fixed unit once you get used to it. And you have the portability. You don't have the power requirements that you have to deal with. You don't have to worry about installing it. If you decide to move, you can physically move it. If you decide you want to do multi-special procedures in those rooms that don't involve C-arms and fluoro, you certainly can have a surgical table in there and pull the C-arm out. And so from that aspect, you just got to not be afraid. I was very skeptical on coming from a fixed unit to a C-arm and what we were going to be able to do and the quality of care we would be able to deliver with that. You got to understand it's not a fixed unit. But when you're talking about what you're capable of doing, you certainly can still do it. I haven't had a case where I've had to convert, nor have I had any cases that I've said, I think I'd rather do this on the fixed unit than on the C-arm. Once you get used to it, and once you see how well it works and you can take a small space and modify it and safely bring procedures out of the hospital and increase efficiency, that it'll be a win-win for everybody. We were worried about edge detection. We were worried about clarity. We were worried about really the detail in which you could see during a PCI. Could you see the edges? Could you see the stents? And so when we tried multiple different pieces of equipment, that GE C-arm, the new one, really made a big difference in clarity on what you can do from a cardiac standpoint. We have done some pretty challenging cases that I wouldn't have expected I would have done on that machine. Some distal left main, some ostial LADs, in some heavier set patients. And we've had fantastic results. And so we've really pushed the limits of what that machine can do in the chest for cardiac procedures. And we really have gotten quite used to it. What we can do in these centers, it's almost twice as fast as you can go in the hospital. And the more and more we use the device, the more complicated cases we do, and the results are still just as good. The C-arm has its own tower where everything's being generated. That articulating C-arm is wonderful. You can pull that monitor right up over the patient's legs and you really can get close and see everything. And the angles that it can create, the flexibility for which you can move it up, down, sideways, forward, backwards, really makes a big difference. It brings that screen right up close. You can do almost everything from the bedside control. Having the flexibility of that monitor to be pulled over, the remainder of the control of the C-arm can all be done basically bedside. There's nothing that requires physically moving the C-arm or anything to be done at the pad level. Everything can be done from the touchscreen, everything can be done from the mobile side. There's so much flexibility in the adjustment for the unit. It really does make it ideal when you're doing multiple platforms in a cardiovascular center. Shooting carotid, shooting cerebral, shooting cardiac, shooting peripherals. It's fast, it moves quickly. It's size-wise, the detector is large enough that you got a nice field of view for cardiacs. You can certainly use it for peripherals. It excels in the legs. Its DSA package is fantastic. All its peripheral features are amazing. The difference between, I think, this C-arm and most of the others is the image quality. I think we've been using it now for probably 8 months, and I've tackled some things I never thought I would have ever tackled. Outpatient, nonetheless, on a C-arm, and we've had fantastic results with it. So I'm very happy with it. Cost-wise, it was the right thing to do for the center. And from a quality standpoint, it's delivering exactly what we expected it to do. Overall, I'm very satisfied with it. It was a good financial decision for the center. It allows us to deliver quality care for the patients and things done at a more economical and a faster pace for everybody, for the patients and for the center. It's a huge win for everybody. And patient satisfaction has been amazing. Patients love coming to a smaller center. They get their own private room. So I'm very happy with it.